Ginger is one of the best anti-inflammatory herbs that we have. Probably on equal to it, especially internally, would be turmeric. And earlier in the week I talked about taking high-dose turmeric, say capsules, as an anti-inflammatory if someone has inflammation in the body. And we've had some great results with that. But what I want to show you tonight is how you can use the fresh ginger. Now you can use the fresh ginger internally and externally. Internally you can grate it on a very fine grater, and then you put it in a little teapot, pour boiling water with it, and it makes a delicious ginger tea. Now that ginger tea can be given to someone regularly if they do have inflammation. I guess the beauty of taking the turmeric capsules, you can get really high dose at once. You can also give it to a person if they're cold. So internally it can be used to warm up the body, it can be used to reduce inflammation, and it can also be used to settle the stomach. If someone has nausea, upset stomach, you give them a ginger tea and it will relieve their nausea. It can be great if a woman's having morning sickness. So that's how you can use it internally, and you can use it externally. Now, where ginger is particularly helpful is in joint inflammation. Now, in a minute, we're going to look at another vegetable that you can use for tissue inflammation, but this is specifically joint inflammation. So this will be, say, a sore lower back. It can be arthritic pain. It can be arthritic pain or gout pain. It can be used for any inflammation in the joint area. And how you make it is you would get a cloth, or you can get a chucks. And what I do is I fold over Glad wrap a few times, and then I put that down and put the cloth on that. And then you grate it. I don't peel it. If it's dirty, you'll need to wash it. And then you grate it on a fine grater, and this is also a great way to do the ginger tea. It's for a sore lower back, and a lot of people have sore lower backs. And what we have to do is we have to listen to our body. If you're doing something and your back's a little bit sore, you've got to stop. Many backs get sore because people keep doing things when the body says stop. And a lot of people don't lift things with their thighs. You should never lift with your back. You should lift with your thighs. So if your back is straight and your knees are bent, you will lift with your thighs. So you've got to look after those backs. So what I'm going to do now, and I'll do it up here so you can see, I'm going to pull one side over and then pull the other side over. I just need a few more pairs of hands here. So what I have done is I've made a little parcel. Do you see that? And the area that only has one layer is the area that's going to go on the sore knee or the sore elbow or the sore wrist or the sore back. And notice when I make my poultice, I've got about 1 centimetre all the way round of plastic. And that will just help so that the moist ginger juice isn't going to soil the sheets or the clothes or whatever. And then Amelia, could you come up, and I'll demonstrate on Amelia how I'll put it. Let's say Amelia has got a sore elbow. Okay. So let's say her joint here is sore. I'll put it on like this, and then I'll wrap it on with a bandage. Now, if there is inflammation in that joint, the skin is going to get very, very hot. It appears that the ginger pulls out the inflammation from the joint to the skin. And some guests have said to me, Barbara, my skin is burning. And I say, can you handle it? Because if you can handle it, thank you. If you can handle it, just keep it on all night. And some people, especially if they have arthritis, the heat feels very, very nice. One lady said it was just burning me, and I say, well, if you can endure it, keep at it, because the heat will often go up and then ease. And then it might get hot again, and then it will ease. And some people get very, very fearful, but it'll never burn the skin. It will never burn the skin. But the fact that the skin gets hot is an indication that there was a lot of inflammation in that joint.